Hello everyone, welcome to my channel. In this video I'm going to talk about toothache. Nowadays everyone is suffering with this toothache because of calcium deficiency or because they are eating so much of junk foods and chocolates. Because of this so many are being really kind of having so much of cavities or tooth pains or gingivitis like this. So one of the main remedy in homeopathy for the treatment of toothache is spigellia. What is spigellia? Spigellia is called as pink root, and its main action is upon treating so many diseases such as angina pectoris, cold affections, constipations, depression, eyes pain, headache, heart affection, neuralgia, toothache, worms, etc. Spigellia acts especially upon the fibrous and muscular tissues of the eyes and heart. The nerves, especially with fifth cranial nerve. It is also for the pain. And the patient is always nervous and chilly patient, especially the spigellia patients are. First, we'll be knowing about some of the key points of spigellia. Left-sided affections, especially left side of the head, left eye, etc. Body painfully sensitive to touch, parts touched feel chilly, visible, audible, and violent and roaring heart is very well marked. Aggravation by touch and pressure, but pressure revealed by neuralgia means motion. Amelioration by rest. Symptoms are ameliorated by lying on right side with head high. Pains are sharp, stitching and sticking. Afraid of sharp pointed things like pins, needles, etc. Pains increases and decreases with the rising and setting of the sun. It is a good warm remedy and expels worm in the children. Even in the adults also we give it. It is always given for the treatment of neuralgia, that is trigeminal neuralgia, mostly left side. Okay, now we'll be talking about tooth pain. What is the main cause for the tooth pain? In the treatment of spigellia, if you take the causation will be from the tobacco smoking. So the patient will be smoking, because of that they are having this kind of tooth pain. Character of pain, how it is: sharp pains that the patient says that it's very sharp, swabbing kind of pains, stitching pains, tearing pain, toothache, very much sensitive to touch. Modalities: aggravation from the cold air, water, when thinking of it, and revealed by eating or lying down. Headache, causation: abuse of tobacco. Location: left-sided headache, starts at the base of the brain, spreading over the head, and finally locating in left eye, orbit and temple of left side. Everything is on the left side. If you are giving spigellia for the right sided affections, if the patient says that I have a right sided headache, or I have right sided toothache, or I have right sided any kind of right sided problem, then the spigellia is not, because left sided is the one of the particular symptom and very much important symptom, and you should also be considering the spigellia for left side. And headache is also because of this smoking and everything. With the toothache, the headache is also kind of accompanying. These patients are very much sensitive, and the tooths are also very much sensitive to touch. Headache causation is because of the smoking. Location: left-sided headache, starts at the base of the brain, spreading over the head, and finally locating in left eye. Character of the pain: violent pain in the left parietal bone, violent throbbing and pulsating type of pain. There is sharp stitching pain through the eyeball back into the head. The head is very much sensitive to touch. Aggravation: headache starts at sunrise, reaches its height at noon, declines by the sunset, aggravates from motion, noise and touch. Ambulation by lying on right side with head high. These are the few symptoms of the spigelia in the toothache. I had given most of the patients for the toothache. Of course, we give it some other remedies, but when I give is when the toothache is accompanied with the headache. And toothache pain is very sharp that time, because the pain is very uncontrollable, intolerable. The patient says, I cannot control this kind of pain, and it is always left-sided affection. There is no right-sided kind of complaints. That time also you can give. There are some other things which are really good for the spigelia, that is heart affections, rheumatic affections of the heart, painful complaints associated with so much of vascular troubles, especially growing out of rheumatic and endocarditis or rheumatic character, irregular of heartbeat with violent palpitation, visible violent and roaring heart with systolic blowing at apex. There is stitching needle-like pain in the chest with pulse. Pulse is very weak and irregular. There is great difficulty in breathing with the pain in the chest. Must lie on the right side with head high. There is pain in the chest just like that of knife cutting kind of thing. These are some points which you should be always ruling out when you observe the spigelia patient. Spigelia is always given for the pain, left-sided pain, that's all. Okay. Spigelia tooth pain is also kind of aggravated from morning and sunrise to sunset. This is one of the peculiar symptoms of spigelia, that only during the daytime the patient will be having this pain. After the sunset there is no pain. Or during the motion, doing any work, the pain increases. When the patient is resting and not doing any kind of work, they are all right. And from the noises, heavy noises they cannot take, because they are very sensitive. Every part of them is very sensitive. Because of that, the noise also kinds of aggravates the spigelia patient. And cold, damp, rainy weather. During the rainy weather, there is so much of tooth pain. That time also you can think of spigelia. When the pain is gone, or when the patient feels better, by pressure. The patient feels better by pressure, means the tooth pain is there, and if they sleep on that side only, putting the pressure on the jaw, they feel better like that. This is one of the very indicated. And they also lie on the right side to reduce the pain. Most of the spigelia patient had seen with the heart affections or with the any neuralgia or eye affections or toothache or headache, everything is associated with the headache. Headache is common with the spigelia. With eye affections also you can think of spigelia when the eye pain is there and everything. And during the worm infestation and stomach ache, when the patient will be thinking which remedy should I be taking for removing the worms in my stomach, that time also you can think of spigelia. Of course, Sina is one of the greatest remedy, but spigelia also kind of helps to expel the worms from our body. So you can try spigellia for different kinds of things, that is eye affections, neuralgias, toothache, headache, heart affections, and worm removals, like this. But the thing is, the patient should be saying that they're having pain in the left side. Okay, this is one of my review on the spigellia with toothache. So if you have any kind of diseases which you want to know about homeopathic treatment, please do comment on the comment section, so that I'll be looking into that and I'll be making a video on that. Thank you so much for watching. Please do like and subscribe, and don't forget to press on the bell icon, because whenever I put a new video you will be notified. Myself Dr. Megha from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. Thank you so much for watching my video till the end. Please do like and subscribe. Bye bye. Have a nice day and a wonderful life.